Welcome to Robbins Live, brought to you by Secure Health. I'm April Bragg, President and CEO of the Robbins Regional Chamber, and we are streaming live on Facebook and YouTube. Our guests today are Houston Healthcare CEO Charles Briscoe and COO Dr. Mindy Hartley. Dr. Hartley, Mr. Briscoe, welcome.
Hello, thanks for having us.
Thank you for being here. Just in a word, how would you describe the last 6 weeks?
Oh, stressful, but yet rewarding when you take a look back at it. The support of the community and our employees, just very rewarding, actually, that we've come through it and looks like we're going to be okay.
That's awesome. And Dr. Hartley, how about you?
Oh, it's been a little surreal. I almost feel like we're in the twilight zone. You know, it's hard to believe that we've been dealing with this pandemic and, it's something you read books about and we're living it. So I think Charles is right. It's made us stronger coming together as a team, but it's been interesting.
Yeah, absolutely. Well, I want to jump right into an issue that has been, highlighted by the president as well as our governor about safety for patients and those seeking medical attention. So, Charles, I'll start with you if that's okay. Can you just share with us, is it safe for patients to go back to the hospital, the med stops, or their doctor's office?
It absolutely is safe. We're doing some things here just to kind of give a feel for where we are. We've started to reopen our surgeries and our Houston Heart Institute, which is our cath lab. And I know we'll probably get into that a little bit later, but our emergency rooms, our med stops, they are clean. We're using state-of-the-art cleaning material. And I believe maybe on the screen here in a minute, there'll be a picture of some of our UV robots that we've had for quite a while, but we've ordered additional robots that we bring into the room, and it provides a UV cleaning. And that's in addition to our environmental services staff that has done a fantastic job and continues to do a fantastic job of cleaning all of our areas per the latest recommendations of CDC. And we are ready. I will tell you, through this whole event, our med stops and our emergency rooms have been down about 50%. And I think most hospitals around the country would tell you that. Which is a little bit of an eerie feeling when you consider those symptoms just don't stop. So I would say not only, yes, it's safe to come back, I would encourage people in the community, if you're having clinical symptoms of any kind, you need to go to the med stop or the ER or your physician, whatever is appropriate for your symptoms. But particularly what we're seeing, not a lot of the critical symptoms that we know are occurring in the community. Chest pain that could lead to a heart attack, or some of the facial weakness or arm weakness, slurred speech that might indicate a stroke. We've just not seen that in our ER during this pandemic. And I would urge the community to take care of yourself. And at this time, I feel very confident that any risk that COVID in the community or in our hospital would pose to you is insignificant to the risk of those symptoms. Particularly the more severe symptoms. So I would encourage you to seek treatment, engage in the healthcare delivery system, be it your doctor, your med stop, the ER, surgical if you need a procedure. Engage in the system. It's time. We are ready. We're at a point where this is manageable, and I'd encourage you to come back.
That's encouraging. So I know, you mentioned that the number of COVID cases is down. In fact, recent data suggests that we have fewer than 10 COVID-19 patients in the hospital here. Dr. Hartley, what about you? Is that a good sign? It sounds like a good sign to me.
It's a great sign, April. When we look at that, and we look at that number every single day, actually this morning, the number is 6 patients that are positive for COVID in the hospital. So that's terrific. At our high, which was April 19th, we had 32 patients in the hospital, and quite a few of those patients were in the ICU. And now we have no positive COVID patients in our ICU. So we're very excited about that. Of course, we continue to make sure that we are utilizing best practices in the hospital, having screeners at the door, and visitation is only for essential visitors. So we'll continue to do that. But we're excited about these numbers. And again, we do track these on a daily basis. So it's something that we will continue to look at.
Very good. Well, and this next question is really for both of you. So we frequently hear on the news about communities who have been heavily impacted by COVID-19, these hotspots. But by comparison, really not so much here in Houston County. Do you think your preparations have something to do with that?
I do. I mean, there's a part of this, April, that, life in the hospital, there is a formal process that we train on. It's our hospital incident command system that in the early stages of this, you may have heard the governor and even the president encourage hospitals to implement their HICS system.
Mm-hmm.
That's what we're trained on. We're required by our regulatory agencies to be up to speed on that. And I would say to a certain degree, that preparation helped tremendously. We are still considered in an emergency preparedness situation. And to us at the hospital, that means we have a certain organizational structure of how we address certain issues. So at a basic level, yes, I think our preparation has been key to the hospital. But, I would be not being totally truthful with the audience if I said we knew all the answers going into this. This truly was an unprecedented event. And, the commitment and courage of our staff and our community is what got us through it. We had to make some calls on the fly. We didn't always get it right, but I think we did our best job. And when we look back on this, I'm extremely proud of the team at Houston Healthcare and of the community for what we've done in response to this COVID pandemic. And so, yeah, I think there was a preparedness that helped, but we didn't really know what was coming at us. This was new to a lot of people.
Yeah, absolutely. And Dr. Hartley, just to kind of follow up on that, looking back over the last 8, 10, 12 weeks, as we saw this, coming across the country, into our communities, into our areas, could you have imagined this? And if so, in thinking through it, are there things that you think you would do differently to prepare for something of this magnitude?
Well, I think you're right, April. It was all over the news. It started out in Seattle, Washington, and you would see all of those pictures and all of the nursing homes out there. And then New York City, those areas were hit so bad. So when we first started watching the news and hearing from our state representatives, as Charles said, we put our incident command structure in place and we started meetings twice a day. So that really did help serve us well. At those meetings, every day we would talk about new things that we would put in place. And like Charles was saying, a lot of them were on the fly. But it's funny, getting prepared for this interview today, we started making lists of all of the things that we put in place. And it really is amazing, especially when we're in such uncharted territory, never dealing with this. There really is no playbook. And even now, things are changing every single day. And as Charles mentioned, we've learned a lot going along the way. We couldn't have done it out with the community without the community support and without our providers and our board. I mean, it has been phenomenal. And as hard as it's been, that's a positive thing that we really have experienced is everybody's support.
Absolutely. Well, and I want to stay on that topic for just a moment, and I'll let both of you respond to this one as well. So, we've been able to have a front row seat really at not only, the yeoman's work that our healthcare providers and first responders and essential, workforce have done during this time, but our community. Wow, guys, they have really stepped up in support of all of those groups I just mentioned. One of my the most humbling things that we've done through all of this is the chamber is field. I couldn't even tell you, probably nearly 100 calls for people saying, how can we provide a meal? How can we support our healthcare workers, our first responders, and all of those? Can you tell us a little bit about what the experience was like being on your end, knowing how tired your staff was, knowing the uncertainty that was before you guys every single day, to feel this outpourings of support from our community? Like, I have goosebumps just talking about it again. And would love to hear your perspective on that.
Yeah, it was overwhelming. It still continues actually today to be overwhelming. The people that manufactured masks and Even went into some 3D printing around the community to get us some face shields and those kinds of things. Just meant the world. The food and people donating the food is just incredible. I'm now officially on a diet. This, I won't get into naming names because I will absolutely leave people out, and I don't want to do that because it was just so incredibly impressive what the community did. The events of, some of the prayer events early on, and the car caravans through the parking lot, the flyover, those kinds of things. Maybe not material in nature, but just meant the world to our staff, to their families, and just uplifted us. And I just can't thank people enough for it.
Amen to that. I have to agree that community support went a long way, and we were dealing with uncertainty and those people at the bedside, dealing with an invisible enemy that you couldn't see. But we had over 200 businesses and physicians' offices and churches reach out to us and provide food and notes and signs and crosses. It was wonderful. It's very touching.
That's amazing. It really is. And like I said, just as sort of a spectator and a filter of all of that love and support, it's been amazing to see. And that same sentiment has been extended to our small businesses and many who were forced to close and loving, our community, just loving on them and embracing them. So we've got a lot of questions to get through. So I'm just going to jump in to some others that aren't necessarily right on target. We've got some in the comments, people asking, and we're going to hit on those in just a second about when people will be able to return into your facilities. But Charles, I wanted to ask you, physicians are an integral part of any healthcare effort. What are some of the unique ways the doctors supported these healthcare efforts?
It was fantastic. I tell you, the medical staff, their commitment and the way they stepped up during this pandemic has just been incredible. I'll point out a couple of examples, but again, throughout this whole effort, when you start giving specific examples, you fear you're leaving people out. And let me just say the entire medical staff should be applauded for what they've done. But a couple of areas I do want to point out, the pulmonologists in the community, and I'll quickly give the names, but Dr. Assad, Dr. Edenfield, Dr. Hossein, Morales, and Dr. Ramuza, they came early on and said, this is going to be a critical care game, and we need to have a dedicated level, a focused level of care in those units. And they really stepped up. We were able to give them kind of that leadership position. They linked arms with the infectious disease physicians and just really took the lead, and were there on the point when clinical protocols needed to change. They were right there. It wasn't a matter of talking to 400 people at once. It was, there's 5 people, 6 people, let's go talk to them and make the change we need to make. Our anesthesia team, now this may be a little inside baseball, but with COVID, one of the highest risk procedures that you can do is an intubation. And as I'm sure most of the listeners picked up on through the media and those kinds of things, there was quite a few ventilators used, and that requires intubation, obviously. Our anesthesiologist stepped up and said early on, we will be the intubation team. We bring the expertise, we bring the focus. That'll limit the PPE usage, that'll take better care of the employees and limit their risk. And then, some of those guys were Dr. J.D. Hall, Dr. Lester, Dr. Woods, and some of their CRNAs. Again, can't thank them enough. The surgical department, opening up, I will tell you, this is one of the things that we are learning right now. But opening up has been a little more challenging than closing down, as you can imagine. And our surgical department, led by Dr. McBride, Dr. David Wiley, and again, J.D. Hall, really providing the expertise, the knowledge of what's going on and how we need to treat patients preoperatively to safely bring them back, is entirely driven by those individuals and others in the surgical department. And we're just administratively kind of following along with them. And it's really been rewarding to watch these guys and others that I know I didn't mention, but were equally important in the care we provided to our community. And back to the preparation question earlier, we couldn't have done it without them. I mean, this they stepped up in a way that really allowed us to do what we needed to do.
That's fantastic. So if you're just joining us, you're watching Robbins Live. I'm April Bragg with the Robbins Regional Chamber. Today's program is sponsored by Secure Health, and I'm here with Charles Briscoe and Dr. Mindy Hartley of Houston Healthcare. So we talk about opening back up, and that's one of the things that we are seeing in the business community as a whole, just the challenges of knowing when to do what. And one of you mentioned just earlier, I think it was you, Dr. Hartley, that every day it seems that things change. And as leaders, it's difficult. You know, you want to be decisive, and your teams count on you to be decisive and direct and firm in your decision making. But when the data changes daily and the governor or the president makes changes, the CDC comes out with new recommendations, those aren't scheduled. We don't have advance notice of when they're going to be making those. How has your internal communication perhaps changed as a result of this? And are you finding any things that have been more successful than other things in your efforts?
That's a great question, April. I will tell you, it's been very interesting because, you know, as a hospital with close to 2,400 employees, one of the big ways we communicated was we all got together in a big room. So with the social distancing that we all need to do, we had to come up with some unique ways to do that. And we implemented and started using more conference calls for meeting, more WebEx, more Zooms for meetings and things like that. But one of the big things that was very successful was we started doing some video town hall talks. And that was well received by our employees. We put information out there for our employees, and we allowed them to send questions in, and then we would do a virtual town hall talk through video. And we like that so much that we've decided that we will continue with that afterwards. The other thing that we learned early on was our employees really were thirsty related to knowledge and information as to what was going on at the hospital level, what we were doing, and the numbers. So we started a daily briefing, and we put that out every single day. And it provides our employees with information on the numbers, where we are, the things that we're doing. We quickly put in place screeners, and so we were able to communicate that out to our employees through that daily briefing. So those were some great new communication tools that we put in place, and many of them we will continue as we go forward and start to get back to normal business.
Wonderful. And I actually think, so we just got to ask a question I'd like to pull up. Has COVID changed the way that you do business going forward? And I think the answer is obviously yes. So if you could share how, and in doing so, if we can pull up the photo of the screeners. And so these are stations that you have at the entrances. Can one of you talk us through this, and then the other changes that you've implemented?
Yeah, I can take that. This was part of our visitation policy, where we have screeners, and these are, for the most part, employees whose normal job has seen either a significant volume reduction, or frankly, we just needed the resource and had to pull them off that job to do the screener function. But this started out early on. It was, the few questions that everybody knew there early on about, had you traveled, had you been exposed to anybody with COVID, or did you have any symptoms, those kinds of things. And it's now, through the course of this, moved through where we still ask those questions, but we're also scanning your temperature every time you come in. And even for the employees, this is one of the creative things we've done. The screeners came back to us and said, the visitors we are allowing in are getting backed up. With the employees that are coming and going, can we create a daily pass that once we screen and say you're okay, they can just kind of come in? But the screeners are there. They're there today. They will be there probably for the foreseeable future. That's not to comment on the visitation policy. I know that's a question of everybody as well. But the screener function has really been developed as we went, and they've stepped up and really owned the process. Peter Tran, our associate administrator, is taking the lead on that, and just they're doing a great job.
A rock star.
Mm-hmm.
Mm-hmm. That's right.
Yeah, very good. We've actually got a related question that just came up. What extra measures are being taken to ensure the ER and med stops are clean and safe? We saw the bot just a little while ago. Any other procedural things, or just kind of the way you do business that has changed to enhance those safety and security measures?
Well, a couple of other things that we did very early on is that we redeployed some of our workforce to other areas. As Charles mentioned, some areas had low census, so we were able to pull those employees out, and we were able to put extra cleaners on. So we're going into those high touch areas, those doorknobs, those desks, those computers, those keyboards, and we're able to get in there and really clean those areas much better than we had. The other thing, of course, that we're doing that is the safety feature is all of our employees wear masks, and we're wearing personal protective equipment. So that is another area. I know we showed the ultraviolet robot, the UV robot that we have, but that is a critical piece of technology related to what we use throughout the system. And so that you're aware, in our emergency rooms, we're using that. In our med stops, we're using that. We also have our regular employees that are very vigilant about their hand washing, which is a key component of what we do. And then after and before they're caring for patients in rooms, they are making sure that all of those things are cleaned down. We have strict rules as well related to getting rid of the garbage out of the rooms. You know, sometimes you don't even think about that aspect, but using gloves related to tying up the garbage and taking that out. Yeah. And so we've been able to use video. We're using some new video education so that we make sure that we review that with employees so that we can have standardized practices.
Yeah, that's great to hear. I think all of us have had to get a lot more comfortable, not only being on camera, right, but delivering our message in video, because, even though it's more permanent than an in-person meeting. There are a lot of benefits to that because people can go back and rewatch, or it doesn't require everyone to be in the same location at the same time. I don't think anything will ever replace an in-person meeting, especially not from an extrovert like me. From my perspective, there's nothing that will ever compare. But it has been really encouraging to watch you guys, to watch others in our community really step out in that area. And I just wanted to commend you real quick. We're going to take one more question, and then we're going to have a brief break to acknowledge our sponsor. And this is another one from Renee. So what lessons learned can you share from everything you identified in your planned emergency preparedness that you might do differently as a result of putting your plan in action? They say the best laid plans, right? And when you get in there, some of the plans just don't work anymore or don't function quite the way that you thought in real time. So can y'all enlighten us a little bit on that?
Yeah, I would, with the emergency preparedness plan, it starts at a very high level of just a few people. And as the disaster, if you will, continues, most of the time when we're in this mode, it's a hurricane or one of these Warner Robins snowstorms, that comes and goes about 5 o'clock. But for it to have one that's lasted now, 7-8 weeks, having the vision to see that you're going to be in this for a while. We're still in it.
Yeah.
And I think early on we realized we're all going to break down if we don't start to think about relief. And so we quickly responded, and each identified a backup and sort of gave some relief to people here and there to come off of their job, if you will, or their assigned task. But, there's a bunch of things that frankly, we're still in this kind of download mode of what would we do better. And I don't know that we've really identified the list at this point, frankly, but I'm sure there's going to be things. We've kind of been focused on the strengths of, one of the strengths that I think, and it's a little limited, that I'm the only one that's really had the exposure, but coordinating with the administrators around Middle Georgia every day just to kind of see what's going on, where things might be heading. Just a daily text with some of the guys in Macon has been very helpful. Just to, if nothing else, it's not about the numbers sometimes. It's just about, we're in this with you.
Right.
That's been helpful. And really, I guess the foresight, I think we did a good job, but I'm sure we missed a few things of, should we have signed somebody to this task a little sooner? I would say maybe the reopening, maybe we could have gotten on that a little sooner. Not to say we're off timing or anything, but it has proven a little more difficult than I anticipated. So that might be an area where when we're done with this, we start thinking, well, if we see another one of these, we need to start thinking about reopening the day we close, just so we're ready for it.
Absolutely. Well, we're going to hit on a topic that you just mentioned, Charles, and early on, Dr. Hartley, I think, said the word stressful. So self-care, it's one of those, those words that when I hear it, I cringe. I'm like, oh, no, but it really is. It's so important that all of your people, regardless of their position or what leadership they're in, as you're in crisis mode and leaning on them far more than you do in their day-to-day activity. What are those things that perhaps either of you have found to kind of give you some comfort and relief and an opportunity to just step back and breathe and put everything in perspective? I'd love to hear from both of you on this one.
I would, for me, my faith is important, and the churches not being able to meet, Sunday schools not being able to meet. I teach a Sunday school once a month. This is my duty in my class at Perry United Methodist, and we'd kind of gotten off track, and I used our WebEx technology to kick that back off. And I just I gave a lesson basically sharing what we've learned, what we've seen, the dedication of our employees, and shared that in the confines or the context of a Sunday school lesson. And that has gotten our class back to meeting, and it was really refreshing and got me back on point and really kind of relieved my stress. So that's kind of the biggest thing I've done to kind of get back to normal a little bit.
Yeah. Mindy, how about you?
Well, I would have to say that I have grandbabies that are 3.5. They're twin boys, and that not being able to be around them, working here, that has been hard. But being able to use FaceTime now, being able to get together that way, and I'm very close with my family. We actually did something 2 weeks ago. We had a tailgate party. Everybody brought their own food, and we were able to get together with social distancing. So faith and family, I think, are something that have helped a lot of our employees out.
Absolutely. And I joked when I moved here 6 years ago that this was the town of the 3 F's, which is faith, family, and Friday night football. And those really are the things that, come rain or shine, they're going to bring us together. I know many people in this community are excited to see football and any sports or large gatherings for that matter to resume, but definitely being able to rely on the other two right now, I think have been a source of constant strength for many of us. So you're watching Robbins Live. I'm here with Charles Briscoe and Dr. Mindy Hartley with House and Healthcare. We're going to take a brief moment to hear a word from our sponsor, Secure Health. Stay with us.
Welcome to Secure Health Plans of Georgia. I'm Mike Musgrave, the CEO. Secure Health was organized over 20 years ago by local business leaders and, along with other businesses in central Georgia, is partially owned by Houston Medical Center. Secure Health was organized with the idea of improving the health and lives of the families in our community and to keep healthcare dollars in central Georgia. Those continue to be our goals. Please give us a call at 478-314-2413 and ask for Lavelle to see how we can help you reduce your healthcare expenses and improve the quality of health of your employees and to keep healthcare dollars in the local economy. Thanks. Stay safe.
And we're back. Oops, I think we might have lost Charles. We're here with Charles Briscoe and Mindy Hartley from House and Healthcare. And Dr. Hartley, I'm going to give you the next question, and we'll get Charles back in here in just a second. But let's talk about this. I know that many are anxious, and I was actually saving this question for after the break because I think there will be some additional questions to follow. But when will visitors be allowed back into the hospital? And, will they be screened? Will they have to wear a mask? Tell us about all the things.
The $1 million question. Everybody is asking that. That has been so hard. That's been hard for us as employees. And I know it's very difficult for families and patients. At this time, we still have the same visitation that's very limited. We are having discussions on that. We are looking very closely at the numbers of COVID positive, and we do feel in the next 2 weeks that we will be able to do something, but we were concerned about doing something before the Memorial Day weekend and because of the changes. We will still be wearing masks because there is a lot of protection related to those masks that we're wearing. But I would recommend folks that you can go to our hhc.org website, and we do have our visitation listed there that you can see real clearly. So for now, we'll do that. And the screening, we will continue to do that because that's a great way to make sure that we keep the patients safe and our employees and visitors safe.
Wonderful. And you can find that website. It's scrolling across the bottom of your screen right now. And let's see if Charles is able to join us, because we actually have two. No, he's still a black box. Hey, Charles, if you want to log off and log back on real quick, we can hear you, but we can't see you. So I'll ask Dr. Hartley these quick follow-up questions, and we'll catch you back in just a second. So, Dr. Hartley, we got a question from, I got to find it over here, early on. Also wanting to know, when will walkers be allowed back into the pavilion?
Yes, that's another great question that we were talking about this morning in our incident command. Again, we think in the next couple of weeks we'll be able to do that. One thing, though, we did want to share with the public is exercise outside if you can. The fresh air and the open air is very good. When we do open that back up, we will be going by the guidelines put out by the governor related to gyms. So we will go by that, and most likely we will be recommending that you do wear the face mask as well.
Very good. And what about volunteers? You know, we mentioned all the outpouring of community support. You have a tremendous staff, if you will, of volunteers who work at the hospital and provide critical support to your hospital staff. What about them? What's the plan?
Well, a shout out to all our volunteers who we love, who we miss dearly. You know, many of our volunteers are over the age of 65, and we do want to make sure that they stay safe. Some of them may fall in that medically fragile category. And so right now the rules are that until June 12th, they should be sheltering at home. So we want to make sure they stay safe, but we miss them and can't wait to have them back here in the hospital.
Very good. All right. And I think we have Charles back. We're going to, yay!
Hey, not sure what happened.
You're back. We missed you. So we've solved all the world's problems while we were gone, and Mindy did a great job. No, we spoke about the visitation policy and exercise walkers and all those things, and she gave us all of that great information. So I wanted to ask you, Charles, I'll start with you, and Dr. Hartley, if you'd like to chime in. Let's talk about the hospital staff for a minute. How would you describe, I know you've mentioned several individuals and departments, but in addition to their role, the morale of the staff through all of this?
The staff has just been fantastic. You know, they no doubt, particularly those that are on the front lines, if you will. And we actually, back to the previous question, that was a term we kind of got away from, front line. The ones doing the clinical work with the patient bedside, there's no doubt they carried the great magnitude of the stress and the realism of the risk that they took in taking care of the patients. And no doubt it was scary and frightening, probably still is to the degree we have those patients. But I tell you, they have stepped up. We were able to do some things for them early on. We realized that the visitation policy, for example, is a great cause of stress for our caregivers, because nobody goes into nursing school or medical school or any medical profession to care for patients without their families. And that is just an overwhelming burden that they've taken on and had to take on. And, you know, so we've done some things for them, like we've had our employee assistance program available to them. We've been sending out devotionals from our chaplaincy that have just been fantastic. I've personally found great value in those, and we've gotten great feedback from our employees as well. We send those out, I believe it's 3 times a week. Just trying to uplift them and give them the support, any support they need any resource they need, just to make sure they've got what they need to do the job they do every day, while trying to take care of themselves mentally, physically, and spiritually.
Yeah. Well, it's interesting. I'm sure both of you have seen, the studies that say that the companies, and none of us really think about the hospital as a company, but those organizations who have taken care of their employees through this time, really being the ones to fare the best coming out of this from a rebound standpoint and recovery standpoint. So let's talk a little bit of the human resources side of this. Has Houston Healthcare had to furlough or lay off any employees due to lack of patients or procedures, and we'll follow that up with the elective procedures and having to put those on the back burner as well through all of this?
Yeah, I would furlough, as you may know, and I know some of the viewers may know, is a very technical HR term, and no, we have not had any furloughs at Houston Healthcare. We're uniquely challenged as a hospital, as you were alluding to. We absolutely have the calling and the burden that we take on every day gladly for the community. It is our mission of caring for our patients. And in this pandemic, that was the focal point. We had to be there for our community, and we were, and I think we did a fantastic job. On the other hand, like you said, we are not unlike some of the other businesses in our area. And as part of society's response to the COVID-19 pandemic, we were asked to close down essentially the vast majority of our revenue producing services.
Yeah.
And we did that. And but as a result, we also carry the similar burden of a business like you may see in the small business world today, unfortunately. And as a result, we did have about 600 employees or so that have had a 20% hour reduction for a limited period of time. We are in the middle of it still today. And we will get out of that. There's been no job loss. There was never the intent, because we know we're going to need them back.
Right.
It's just right now we had to make that call and try to do it in a way that recognized their commitment, recognizes the need for them in the future. And I will say, as much as everybody celebrates and pats on the back for the clinical team at the bedside, and that is absolutely warranted. We can't do enough of it. I just want to point out to the community that there's about 600 employees here that have made a financial sacrifice that is equally important to us maintaining our mission during the COVID pandemic and in the future as we go forward to meet our, I guess you could call it our normal mission. We will be better off both because of the commitment of the clinical team and the sacrifice of those 600 individuals. And I know that doesn't make them feel any better about it, but they need the love and support just as much as the clinical team for the sacrifices they have made.
Well, our good friend Gary Hart has a related question along those lines. In thinking about the entire team that it takes to pull something like this together, what can our community do to help? As we mentioned, they've brought meals for those that are providing that bedside care. Is there any way that whether they can direct care to those that may have taken the pay cut or anything like that, PPE, et cetera?
Well, the PPE, we are, as we're transitioning into opening back up, we're, the clinical upstairs inpatient care PPE we're in pretty good shape. We've been able to maintain the mask through a lot of the contributions that got us to the point to where the supply chain was restored. So we're okay there. Our concerns now are in the surgical PPE. And we have pretty good supply right now. It's just a concern globally about the supply chain. It's not necessarily an acute need here. Our employees that are taking the reduction in hours, they are able to use the benefits they have in terms of their paid time off. So they're actually, to the degree they have those, they're not necessarily, or absolutely, I should say, not absolutely going without a paycheck in full.
Right.
So we have opened up some of the benefit options for them to maintain pay. But, the contributions the community makes, we've said it before and can't say it enough, that it's very much appreciated. And, I think we're about through this. I will tell you one thing on the PPE that the community needs to realize. Early on, gowns, non-sterile gowns, was a significant shortage. It really didn't get the attention that the masks got. And we had, I don't know how many employees quickly assembled down in our basement conference room. They cut out different templates. And we have made throughout the pandemic here within the basement of our hospital, and this is a real number, 35,000 gowns.
Wow.
Our staff has cut out and made out of plastic. We've had to procure a 1.4 million, I believe, square feet of plastic. We were able to get and make that many gowns just in our conference room downstairs in the basement. So, I know there are other efforts in the community going on that are equally impressive, but talk about creativity of our staff. That took all of about 2 days to figure it out, and they were off to the races.
That's amazing. It's amazing what you can do when you're pressed hard enough to come up with a solution. And I'm never disappointed in the efforts of our community and the staff to step up. So we have a question I'm going to take, and Dr. Hartley, I think this is probably going to be for you. Can people come to the hospital to get COVID-19 tests, and what qualifies one to be able to be tested at the hospital?
Okay, good. Another good question. We do get a lot of those questions, and our tests, we still are limited in the numbers of tests that we have. So we are not doing tests widespread through the community. There are physicians' offices that you can contact, you can get tests, and there is the ability to work with the public health if you have symptoms and want to get tested. What we do with our test is that we are testing patients that come in. All of our labor and delivery patients get tested. Those patients that are from a nursing home get tested because, that's been an area that's been hit very heavily. As we added our surgeries, we do test those patients before they come in. And then patients that are in the hospital with signs and symptoms, we are testing those. So all of those qualify for tests.
Wonderful. That's great to know. I'm going to do one more reminder. If you have any questions that you would like us to consider, please drop those in the comments as we begin to wrap up. So I'll ask this question of both of you. What's the silver lining here for you?
I would say the silver lining for me is how the overall hospital community, as a medical staff and as a board and hospital staff, have come together and really just tackled this thing. You can feel it, in my opinion, in the four walls of the hospital. It's just a tighter, more cohesive group that. Me, still relatively new CEO to the system, it's been rewarding to see the organization respond and tackle these tough issues. Even as our executive team, we've had turnover in the executive team recently, so we've got some new positions, and Mindy being one of them, a great return to our executive team, by the way. You never know, the old saying, you don't know how strong a team you have until you face a challenge. And I think our executive team has come through with a new understanding and appreciation for one another. And I think that has gone throughout the organization, across all departmental lines, across the medical staff. And those are the silver linings for me. That's what I'm going to take away as the strengths and the growing points going forward.
Very good. Mindy?
I have to completely agree with Charles. It's been amazing. I came in 2 weeks. I came back to work 2 weeks before this outbreak happened. And there were some new players on the executive leadership team. And you know how when you first come back, it's a little awkward and this, that, and the other. But a week into COVID, we were all best buddies, and everybody band together, and the employees were exceptional. The community cheered us on, and we couldn't have done it without them. Brass tacks, a couple of things that I've heard different people say is the technology that we're using. People love that. A lot of people seem to be enjoying the telehealth medicine with their doctor's offices, and that's probably something that'll be here to stay. But I think Charles nailed it, related to growing closer together as a group of workers and within the community.
That's amazing. And I will say, as a firsthand witness, the technology works. I had my first WebEx appointment on Monday, I believe, and just for, check up on labs and get that report from my doctor. And it was so seamless and so easy. And I wasn't sure how it was going to, work out, but a great system. And so glad to have that here as an option for people, whether the doctor's office is open or whether you have limitations to getting in, you can still see your doctor face to face. It may just not be in person all the time, and that's okay. So any closing thoughts? If there's, one resounding message that you want to both leave our audience with before we wrap this thing up.
I would just say, to your point on telehealth, just one point, that is here to stay. And that's something that I would have told you in January was 3 to 5 years away from Middle Georgia. And it happened in about less than a week. Yeah. The adoption of that technology in the medical practice and the physician practices. So I would just add that. But just to close, I can't thank the staff enough, the community. When this is all said and done and we look back on it, this is going to be, I think, our moment in the community where we were able to step up and do what we had to do. And we could not do it without the dedication of every employee and member of the medical staff. And we could not do it without the absolute resolute support of the community. And it was palpable. It still is. We hope we can continue to earn that support and love of the community as we go forward and start to come out of this. But for me, that's the bright spot. And that's what we're going to hope to grow upon going forward, is to be an even more integral part of our community and to be that healthcare delivery system everybody in Houston County can trust and rely on each and every day to meet their needs.
I love it.
That's great. And thanks to you, April. I mean, Charles really said it all, but we appreciate that you gave us this opportunity to be here to share some information about the hospital and let everybody know that, we're open for business. Take good care of yourself, be safe, follow the social distancing, wear the mask and those things, because it's very unknown, what is going to happen over the next several months. So I think that we will be much more prepared as we move forward because of going through this.
Absolutely. And we'll put that website up one more time, just in closing. And as Dr. Hartley said, there's a lot of information that they were both able to share with us today. So if you've been watching and you have someone in your family, someone that lives here in Houston County or in our footprint that knows and needs this information, please make sure you share this broadcast with them. They can rewatch here on Facebook or on our YouTube channel. And that's it. That wraps us up for today's edition of Robbins Live. Thank you to Secure Health for sponsoring today's episode. And once again, thank you, Mindy and Charles, for being here with us today. We'll be right back here next Wednesday at 3 p.m. And my guest will be Jeff Thompson of Costangi Brooks. And we'll be talking about legal considerations for business in a post-COVID-19 environment. We'll see you next week.